Hello everyone, my name is Maharlika Diarse and I am going to be doing IV fluid and medication skills video. Before I start, I have my Nightingale scrub top, Nightingale scrub bottom, a Nightingale badge. My hair is up, there's nothing on my nails. I have my wristwatch. Yeah, so before I start, I am going to explain the equation. Here's my equation. So the fluid will be 38 drops per minute. And then the amoxicillin that is ordered, the medication, it will be 100 drops per minute. Alrighty. And before I start, I will show you guys my supplies. I have my gloves, my fluids. I have my amoxicillin. I have alcohol pads. I have my primary tubing, 15 drop factor, and then my secondary tubing. These are my last pair. I already used them on my prior skills video. I tried to get most of the liquid and medication out, but yeah, here's my last ones, and then these are my last ones too. So, and then I have my IV pole. All right. Before I give any medications, I am going to ask the patient for any allergies, if he or she has any allergies, and I can also verify the patient has any allergies on the patient's charts. And then also I'm going to verify the physician's orders. I am going to perform the 6 rights of medication administration. It is the right patient, right medication, right dose, right time, right route, and right documentation. All right, and I'm going to take this time to identify the patient. I'm going to check the patient's wristband, and I am also going to I'm also going to ask for the patient's name and date of birth. And then I can also use that information and correlate it to the patient's chart. And once everything looks right, we are ready to go. And I did ask for allergies already, and the patient has no allergies. And so I'm going to provide the privacy curtain, and then I'm going to wash my hands, and then everything's correct. I already asked for the allergies, no allergies. Wash my hands, and now I'm going to put on my gloves. I'm going to put on my gloves. So now I am going to talk about my primary tubing. So this is the primary tubing, and I'm going to take it out. And I'm going to start right here. Alright, so right here, this is the spike, and this has the cap, and this spike goes into the fluid or the medication. And this spike is sterile up until I take off the cap and I insert it into the fluid or the medication bag. And then right here is the drip chamber. This is where you fill up the fluid or the fluid, and you put it halfway, and then there's air, and then this is where you also count how many drops, and this is where you can ensure the proper amount of drops that will be of fluid that will be coming down the tubing. So then this right here is the roller clamp, and so the spike, the drip chamber, and then the roller clamp. You always have to make sure that the roller clamp is rolled down before you prime any tubing to prevent it from leaking out all the way. And this is where you can regulate the rate of the drops in the drop chamber. And then And then right here is the Y port. This Y port right here, it's this is where you can attach the medication, and you can also do a IV push medication onto here. And then yeah, and then this goes into the patient. This is the adapter, and this goes straight to the patient's IV insertion site. Alright, so that is my primary. And then it's almost the same thing for the secondary. I did it second, but so the only difference between the primary and the secondary, same thing. The spike with the sterile, it is sterile with the cap on, drip chamber to regulate. You can ensure how many drops there is that is going through the tubing. The roller clamp, roll down all the way to make sure that the fluids don't, the medication does not leak out. And you notice right here there is no Y port, since this is for the medication. No Y port. That is the difference between the primary and the secondary. And here is the adapter that you will put into the Y port for the primary. Alrighty, so this is this right there. Okay, so now I am going to prime my fluids. So I will prime it. So this is my fluids right here. So I will take out my the cap from the fluids. Now I am going to take out the spike cap. Now I am going to insert the spike into the fluids. It's a little hard. Okay. Now that I have inserted it, before I turn it over, I always have to make sure that the roller clamp is down to prevent any fluids from leaking all the way through. So now I am going to hang it up. I ensure that the roller clamp is down, so now I'm going to hang it up onto my IV pole. Alrighty. So now I'm going to prime the tubing. I'm going to prime the tubing. I'm going to ensure that there is no air bubbles. So now before I prime it, I have to fill the drip chamber up halfway. Alright, so the drip chamber, it is halfway. So now I am going to unclamp undo this cap for the adapter, put that aside. So now I'm going to prime the tubing and let any air bubbles out. So now I'm going to slowly unclamp the roller clamp. And we have to make sure that the fluids is 30 inches above the patient's IV site. So now that I am primed my tubing, I have primed my tubing. There are no air bubbles. Now I can, since now that we know that our fluid has to be at a 38 drop per minute, I can slowly unclamp the roller clamp, and I will count the drops here in the chamber for a whole minute, starting now. Alrighty. So now that I have regulated the drops per minute, which is 38 drops per minute for the fluids, I will now cap this back on, and that has been primed and it has the 38 drops per minute. Alrighty, so, and the roller clamp is all the way down to prevent it from leaking through. So now that that is good, now we have our amoxicillin, the medication. So now I am going to attach the secondary tubing into the amoxicillin. So the roller clamp is all the way down. We always have to make sure to prevent the medication from leaking. So now I have taken off the cap of the amoxicillin, and then now I am going to take off the cap of the spike. Alrighty, so now I'm going to insert the spike into the medication. Alrighty, so before we turn it over, always make sure that the roller clamp is all the way down to prevent the medication from leaking. So now that it is down, I am going to flip it over, and now I'm going to hang it. Alrighty, so since we are going to be putting the amoxicillin into the patient, I am going to lower the fluid below and I will put the medication higher. So, and then now I am going to attach the medication, the amoxicillin, to the fluid. So in order to do that, I have to uncap the cap from the secondary tubing, hold that, and then now I am going to I am not going to do it. How about put the cap back on, and then I will alcohol the Y port. Now we are going to let that air dry. Now that it is dry, now I'm going to uncap the secondary tubing, put the cap right there at a nice clean flat surface. Now I'm going to attach the secondary tubing into the Y port. Now that is attached, I am good. So now I am going to prime the medication tubing, the secondary tubing. So in order to do that, we have to fill the drip chamber halfway. So now, since we know that the drops per minute is 100 drops per minute for the amoxicillin, but before that, let's take out some air bubbles. So I'm going to uncap the adapter here to the patient, put that on a nice clean flat surface, and then now I am going to slowly unroll the roller clamp from the secondary tubing from the amoxicillin to take out any air bubbles. Alrighty, so now that there are no air bubbles, now I am going to count a whole minute, so this will be faster. This will be faster, the rate drops per minute. But before I count the whole minute, I am going to attach this, and I am not going to attach this, I'm sorry. I am going to unroll the fluids and unroll the fluids roller clamp, and I will set it at a rate of 38 drops per minute. That is at a slower rate. So now that I have it at a slower rate, now this one I have to count for a whole minute the amoxicillin for 100 drops per minute, and that will be a faster rate. So now that is at a faster rate, and it is going 38 drops for the fluids at 100 drops per minute, and I will start now. Alrighty. So now I am going to clamp both roller clamps down. I had the amoxicillin at 100 drops per minute, and then I had the fluids at 38 drops per minute. So now I am going to put the adapter back on, and since I have both of those at the correct rate, we are good. And now I am going to assess the patient's IV insertion site and make sure that there's no redness and the patient is comfortable. He or she is good. And now I'm going to clean up, throw these away. We're good. So the patient is good. I give the patient his or her call light, and they're hooked up, and I will take off my gloves, throw it in the trash, and now I'm going to wash my hands, and then I'm going to document what I have just done, and we are good. Thank you so much for watching. Thanks.